Namaste and good morning, everyone, on this beautiful Saturday morning. My name is Ritesh Malik, and on behalf of Canada India Foundation, I welcome you all to this important webinar on obesity and type 2 diabetes, current and emerging treatments. Every statistic or media report that we hear today regarding diabetes is enough to give all of us another chronic disease, blood pressure, which further leads to many other chronic issues. Seriously, this old disease that finds mention even in the ancient Ayurveda literature has exploded in the past 3 or 4 decades to become an epidemic of gigantic proportion. We also have with us Dr. Harish Verma, who is one of the renowned Ayurvedic practitioner in Canada and has done a lot of work here on preventive side. Today, over 3 million people out of the total population of 38 million in Canada live with varying degree of diabetes. And for those of us who carry the Indian DNA, the picture is even more challenging. India today is often referred to as the diabetes capital of the world, with 80 million people coping with the disease. Worse, it is likely to climb to 135 million in 20 years. According to some experts, Indians may be at a higher risk to develop diabetes along with other cardiovascular diseases. So, in CIF's continuous efforts to inform and educate the community on vital issues, today's topic is a most timely and appropriate. Almost all of us know of someone living with the disease, and there are so many puzzling questions that people want answered. What causes it? Lifestyle, inactivity, aging, obesity, modernization, and what can we do about it? To answer some of these questions, we have invited to our platform one of the most authoritative voices in diabetes research, Dr. Satya Dash. Dr. Satya Dash is an endocrinologist and assistant professor at University Health Network, University of Toronto. He is a clinician scientist with an interest in obesity and cardiometabolic disease and is the medical director of the bariatric program at UHN. He's also one of us so that he can address the special vulnerability we face in depth. It is my pleasure to invite Dr. Satya Dash. Dr. Satya Dash, it's all yours.
Thank you so much for the kind invitation. This especially means a lot to me as I was born in India and Canada is now my adopted home. So this is truly a great honor. So I'll start to share my screen and then I'll begin. Can you see my screen okay? Just wanted to make sure.
Yes.
Okay, excellent. Yep. Thank you so much. So these are my relevant disclosures, my research funding and speaking and consulting fees with pharmaceuticals. And today I'm going to really try and answer three main questions. Why are some people more prone to gaining weight than others? Why are some people, particularly people of South Asian descent, why do they have a higher risk of type 2 diabetes? And what are the currently available treatments that are available for treating obesity and type 2 diabetes? And what are some of the barriers to accessing them? Now, obesity is a problem worldwide. So if you look across the world, about 12% of adults have obesity, and about 5% of children have this condition. And the worldwide healthcare costs of this every year is about $2 trillion. So quite astonishing. Now, if you were to look at Canada and India, in Canada, close to a third of adults and children have obesity. Now, in India, the proportion is less. It's closer to the world average. About 5% of adults have obesity and about 18% are overweight. But as we will see, the concerning thing about India is the rate at which this is going up. Another concerning thing is that people from India and of Indian descent typically develop complications such as type 2 diabetes, which are associated with obesity at much lower weights. Now, why is obesity a major problem? Well, simply put, it affects every system in the body. It increases your risk of getting heart disease and stroke, many cancers, liver disease, it affects fertility, it affects breathing, it affects joint pain, mental health, pretty much everything. But today, we will mostly be focusing on type 2 diabetes. And the reason for that is, well, first of all, if you have type 2 diabetes, your risks of all these other conditions go up substantially. Further, if you have type 2 diabetes, you're much more prone to other health conditions, for example, kidney disease, neuropathy, peripheral vascular disease. And on top of that, as I've alluded to earlier, people of South Asian descent are particularly prone to type 2 diabetes at much lower weight thresholds than, say, for example, Caucasians. And this is a theme that we will be returning to. So just look at the numbers here. So in Canada, it's estimated that 7.5% of adults have diabetes and about 12.4% have prediabetes. India, the proportion of adults with diabetes is actually higher, despite the average weight being lower. As a percentage, fewer people in India have obesity compared to Canada, but the diabetes rates are higher. Now, let's talk about the first question. The first question I'm going to tackle is, why is it that some people are more prone to gaining weight? And this is especially important to tackle because there's a lot of stigma around obesity. And I mentioned this to all my patients, and most of them are surprised when I tell them this, that the genetic component to the tendency to gaining weight is anywhere between 40 and 70%. How do I know that? Well, this is a study from Scandinavia. And what they used to do in Scandinavia about 50 or 60 years ago is they used to, when they put up twins for adoption, they would put them up for adoption in separate homes. So these are twins, and they were brought up in separate environments. In this particular study, they were then studied when they became adults. And if you look at it, the identical twins have very similar body weights, and they have very similar body shapes. With non-identical twins, there's more variability. So with a study like that, you can estimate how much of the tendency to gain weight is hereditary. And it's anywhere between 40 and 70%. And so we've identified a number of these genes that predispose to obesity. And what do these genes do? They will make you feel more hungry, and they make food much more rewarding. So we're all wired differently. So the amount of food that it takes to make us feel less hungry, to feel full, will vary from person to person. And the rewarding aspects of food, how rewarding we find food, will also vary from person to person. People who are predisposed to gaining weight will often feel more hungry, and they'll find food much more rewarding. Now, you will, a sort of point that's often made is, well, 50 or 60 years ago, or 100 years ago, we didn't have obesity as a major health concern. So what is it that genetics does? So I think it's worth reviewing that. So if you were to take a population and you were to plot their weight adjusted for height, and here you were to count the number of people, you will have some people who are overweight or obese. You'll have some people who are thin, and then you'll have some people somewhere in between. Where you are on this bell-shaped curve is largely determined by genetics. So in other words, if I were to take 100 of you and I were to rank you from 1 to 100 in terms of your weight adjusted for height, the person who's ranked 1 will likely have the highest genetic risk for obesity. And the person ranked 100 would likely have the least genetic risk. And so what's happened over the last, say, 50 or 60 years? What's happened is that this bell-shaped curve has shifted to the right. So society in general has got heavier. And this is entirely down to the environment. And there are lots of factors, ready availability of highly processed food, poverty, social inequality, and food insecurity, reduced physical activity. There are potentially multiple causes. So the environment is the driver for the obesity epidemic. But where one sits on this bell-shaped curve is largely determined by genetics. So my first take-home message, and this is important because of the societal stigma around obesity, is that the tendency to gain weight is largely down to genetics. And in particular, a person's weight relative to their peers in any given environment is largely influenced by genetics. Now, next question is, how do we define obesity? Traditionally, what people have done is that they have defined obesity by something called a body mass index, which is your weight adjusted for your height. And what you do is you take your weight in kilograms and you divide it by the square of your height in meters. And 20 to 25 is considered normal, more than 27 is considered overweight, and more than 30 is considered obesity. And these definitions have implications, because this then determines who has access to obesity treatments. Now, the problem with this is most of these metrics are derived from people of Caucasian descent. And therefore, these particular thresholds likely do not apply to minority groups, and in particular, South Asians. So perhaps a better definition of obesity would be, obesity is a condition associated with impaired health due to excess weight, whatever the BMI might be. And just to illustrate this point, this is a study from the UK. They looked at more than 1 million people. And what they used is, they looked at people with a BMI of 30 or more amongst Caucasians, and they compared different ethnic groups. And they looked at the risk for type 2 diabetes. Interestingly, if you're South Asian, if you have a body mass index in the normal range, so 23.9, you have the equivalent risk of diabetes as a Caucasian person with a BMI of 30. So what does that mean in terms of actual numbers? So let's say you take an average South Asian man, height say 1.7 meters, 5 feet 7. 23.9 BMI is equivalent to 69 kilograms or 152 pounds. What would the equivalent weight be for a Caucasian to get type 2 diabetes? It'd be 86.6 kilograms or 190 pounds. This is close to a 40-pound difference. So a South Asian gentleman will develop risk of type 2 diabetes when they're 40 pounds lighter. If you then take, say, an average South Asian female, let's say the height is 1.6 meters, 5'3", a BMI of 23.9 is 61 kilograms, 135 pounds. At the same height, someone with a BMI of 30 of a Caucasian background would be 76.5 kilograms. So that's close to 35 pounds more. So this is the challenge for South Asians. We develop type 2 diabetes at so-called normal weights. So from now on, this is an important disclaimer. For the rest of the presentation, I'll be talking about type 2 diabetes. Everything that I say from now does not, is pertinent to type 2 diabetes, but likely isn't pertinent, most of it, to type 1 diabetes. And so if you have type 1 diabetes, the mainstay of treatment is insulin. And so if you do have a diagnosis of diabetes, it's important that your physician differentiate what kind of diabetes you have and to confirm that you do have type 2 diabetes. And I'd be happy to discuss that later if anyone has any questions. So the next question is, why do people in general develop type 2 diabetes? And why is it that people of South Asian backgrounds develop type 2 diabetes at lower weights? And the answer, this is very similar to real estate, the answer is location, 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 where you gain weight. So, for example, if you gain weight around the middle, that is very bad for your risk of developing type 2 diabetes. If you have very little fat on your thighs and buttocks, that is also very bad news for developing type 2 diabetes. And so if you were to look at it, genetic factors are very important in where you store your surplus fat. Men in particular are also at a disadvantage, and South Asians are also at a disadvantage. We are generally more prone to this type of fat distribution. And this then increases your risk not only of type 2 diabetes, of liver disease and heart disease. In contrast, if you're more prone to gaining weight around the thighs and the buttocks and less around the waist, you can gain weight but not develop type 2 diabetes or heart disease. And in general, women have this type of fat distribution at least before menopause, and so they are protected from this. So the question is, why is this type of fat distribution good? And the previously talked about fat distribution, this one, why is that bad? Well, the answer is your surplus calories have to go somewhere. And your fat cells in your thighs and the buttocks are a very safe space to store calories. Now, if you don't have many fat cells there, or the fat cells there become full because you've gained some weight, these surplus calories have to go somewhere. And in South Asians, with a BMI of 23.9, these fat cells end up becoming full, so you've lost your safe space. So where do the surplus calories go? They go to your liver, they go to your pancreas, and they go into your muscle. And that's where the problem starts. If you get fat in the liver and the muscle, these are the main organs that take up sugar, get rid of sugar. So, and insulin is the main hormone that facilitates that. If you have fat in those two organs, insulin stops working properly. So you get a condition called insulin resistance. And so the insulin is not able to lower blood sugar. And gradually, so what you do is you end up producing more insulin, but gradually over time, you're unable to keep churning out so much insulin, and then you start the amount of insulin you produce goes down. One of the other conditions that predisposes to that is the fat in the pancreas. Over time, it makes you produce less insulin. So you're resistant to insulin and you're producing less insulin. So your blood sugar goes up. And so typically you start off with insulin resistance. You then get increased blood glucose, but not quite at the diabetes threshold, pre-diabetes. And then over time, you end up developing type 2 diabetes. And the reason for mentioning that is you can actually potentially intervene. If you intervene at this stage, you can potentially prevent pre-diabetes. If you intervene at this stage, you can potentially prevent type 2 diabetes. So the key is identification, identifying people who are at these stages, and then potentially you can prevent pre-diabetes and type 2 diabetes. And the good news is you can actually, in some cases, reverse this process. So who should be screened for type 2 diabetes? I would say irrespective of your ethnicity, age more than 40 in the current obesogenic environment, I think it's worth getting screened for pre-diabetes and diabetes. And the easiest thing to do is to see your family doctor and get the blood work done. For women, if you develop diabetes during pregnancy, your risk of developing type 2 diabetes is high, and so you should also get regular screening. If you have an immediate family member, so parents and siblings, with type 2 diabetes, you should also get screened. Now, this is particularly pertinent to people of South Asian descent. One of the most reliable markers of insulin resistance is you get a darkening of your skin, typically in the neck or under the arms. And sometimes it can be associated with skin tags. If you have this, very likely you are insulin resistant. And you should definitely see your family doctor and get the necessary blood work. Who else should be screened? As I told you, BMI, body mass index, so your absolute weight is not so reliable in South Asians. But if you're a man and you have a waist circumference of more than 90 centimeters, or 35 inches, so look at your trouser sizes. If you wear it just below the belly button, if it's 35 inches or more, you should get screened. If you're a woman, 31 inches or more, you should get screened. So the take-home message is South Asians can develop type 2 diabetes and other health concerns associated with excess weight at so-called normal weight. And you should get screened for type 2 diabetes or pre-diabetes if you have a family history of the condition, if you have darkening of your skin in the neck and underarms, if you have trouser size above 35 inches for men and 31 inches for women, if you've had diabetes in pregnancy, or you're older than 40. Now, the next question, and there was a question that was asked before the talk, is can lifestyle measures help in preventing, delaying, or reversing type 2 diabetes? And the answer is potentially yes, with physical activity and weight loss. So for the next few sections, I will talk about weight loss for people with obesity and or type 2 diabetes. If you have type 2 diabetes, you will likely need other medications. So this does not substitute for a consultation with a specialist. Now, first of all, exercise. When people think about exercise, these are the sort of images that conjure up. This is a photograph of me earlier this morning. I usually wake up and warm up with a 100-pound dumbbell, first thing as I roll out of bed. And so, but people think of weights in the gym, high intensity sort of exercise on Peloton, and these things are good. These things are very good. If you do this, it can maintain your current weight. Or if you're losing weight, it can maintain your muscle mass and help you maintain the weight loss. But this is an important thing. And when I say this to my patients, most of them are surprised. Every time your muscles move, they contract, they take up blood sugar. So simple things like walking. If you just walk, even if it's for 2 or 3 minutes, your blood sugar will go down and you will become more sensitive to insulin at the time. So what I tell all my patients, particularly those with type 2 diabetes, is if you can do 2 or 3 minutes of walking, it can be within the house, after you've eaten, your blood sugars will go down. Now, sure, if you can do more than that, by all means, go ahead and do that. The resistance exercise, the high intensity exercise, if you have time to do that, by all means, do that. But even if you just do 2 to 3 minutes, that's 3 times a day. Most people eat 3 times a day. 6 to 9 minutes, you will get beneficial effects on your blood sugars. It will also help with your mental health. It will also help with your blood pressure. So even 2 to 3 minutes. And for most people, that is doable. Obviously, there will be some people who have joint problems, have other health conditions that, because of which they won't be able to do it. But for most people, this is doable. Now, with weight loss, you can definitely improve your blood sugar. Even 5%, if you lose 5% of your current weight, your blood sugars will get better. And so if you have pre-diabetes, that may be sufficient to prevent diabetes, and your blood sugars may even normalize. Now, if you have type 2 diabetes, and it was diagnosed recently, say in the last 6 years, with 10 to 15% weight loss, you can potentially achieve remission of diabetes. If you've had diabetes for longer, let's say more than 6 years, then potentially you need much more weight loss, about 20 to 25%, potentially to achieve remission of type 2 diabetes. So the 2 take-home points are that even modest amounts of weight loss will improve blood sugars, but further, the earlier you intervene in the trajectory of pre-diabetes and diabetes, the earlier you intervene, the more likelihood that you will achieve remission, and you need less weight loss in order to achieve remission. So it's always worth being aware of this fact that the earlier you intervene, the greater the benefits. And this is a theme that I'll come back to. Now, let's say you achieved 15% weight loss and your diabetes didn't go into remission. Your health will still improve. Your blood sugars will get better, your blood pressure will get better, and your mental health will get better. So it's never a wasted effort. And the other point I'd highlight is that this is best undertaken in consultation with a physician. Now, is there a particular type of diet that I favor? And the answer is no. Because if you look at it long term, most diets achieve similar results. And most people who lose weight with diet eventually regain the weight. And the biggest predictor of whether you will sustain weight loss with a diet is adherence. How easy is it for you to stick with that? So the key is to make changes that are sustainable and easy to do. The one thing, however, I tell all my patients, anyone who's ever seen me for weight loss, I always advise them to increase the consumption of green vegetables. The more, the better. It will keep you full. It has lots of fiber. It has lots of health benefits. Nuts, particularly, specifically if they're unsalted, not roasted, they're very good. And lean sources of protein. So chicken, turkey, if you're vegetarian, and particularly for desi palate, dal, chana, chickpeas, they're all very good. And the more of those types of things you have, the healthier you will get. Another thing, a lot of us nowadays, myself included, if I'm not careful, we end up watching a screen, either a computer screen or a TV screen when we eat. And a number of studies have shown that if you look at a TV screen, you end up eating more. Another piece of advice that I'd give is avoiding juice and non-diet soda. These are effectively empty calories. And what they do is you'll get a big increase in the blood sugar, and then the blood sugars come down, and then you get hungry again. So I would recommend avoiding those altogether. Just one other point. Instead of juice, if you have whole fruit, because that has a lot of fiber, that is absolutely fine. If you have diet soda, that will not affect your weight or your blood sugars. So most people, when they go on a diet, they lose weight. But if you look at it over time, they find it difficult to sustain the diet, and most people regain the weight over time. Why is that? Well, there are biological reasons for that. When you lose weight, you get a number of changes in various different hormones in the blood. And what these hormonal changes do is they signal to the brain. They send a signal to the brain, eat more. They also tell the body to become much more efficient at conserving energy. And so as a result, over time, most people regain the weight. And for that reason, we often use medications in conjunction with lifestyle changes to treat obesity and or type 2 diabetes. Now, these medications should always be used in consultation with a physician. Now, the one thing, the biggest barrier to accessing these medications for weight loss is cost. Now, where things get a little bit confusing is, and this is especially so in Canada, some of these medications are also approved for type 2 diabetes. And that creates confusion. And I'll come on to that in the next slide. Now, how does this affect people of South Asian descent? Well, the guidelines recommend weight loss treatment based on Caucasian thresholds. And so this impacts minority groups, and particular South Asians, especially the ones who have not yet developed type 2 diabetes, but may benefit from weight loss because they can't access some of these medications. Now, for people who can potentially access these medications, insurance companies will only approve some of these medications for treating diabetes, but not for weight loss. So there's a little bit of bias there. So what are the available treatments for obesity? This is 2 to 3 years ago, life was a little bit more simple, or even 4 or 5 years ago. The two most commonly used medications were Contraid, which was a tablet, cost $250 a month, and you take it twice a day, and you lose about 6 to 7% of your weight. Then there was an injection called Saxenda. Originally, lower doses of this medication were approved for type 2 diabetes, but the higher dose, which was called Saxenda, is a daily injection, and it can cause weight loss of up to 8%, but very expensive. A few years ago, there was a medication called Ozempic at a dose of 1 milligram, which was approved for type 2 diabetes, but it also caused weight loss. And the 1 milligram dose cost significantly less than Saxenda, and it led to more weight loss. So many people started prescribing Ozempic off-label for weight loss because it was the cheapest and most efficacious medication for weight loss at the time. More recently, it's become confusing because a higher dose preparation of Ozempic, which the company calls Wegovy, has been approved for weight loss. And at this dose, it can cause weight loss of up to 15% in people without type 2 diabetes. We don't know how much it will cost in Canada, and it hasn't launched yet, but certainly in the States, it costs upwards of $1,000 a month. And to make matters more confusing, there are a number of new medications that will be emerging, which will be used to treat both diabetes and obesity. So the take-home message for this section is even modest activity, especially around mealtime, can improve your blood sugar. Weight loss can prevent and or improve and even remit type 2 diabetes. But the key is to make sustainable dietary changes. We have effective weight loss medications, but they're expensive and the coverage is variable. And so many people who need it can't access it. And a further point I'd make is because the weight thresholds at which these medications are approved are based on Caucasian thresholds, this disproportionately affects South Asians who have not developed type 2 diabetes. So are there any other potential treatments for obesity and type 2 diabetes? Well, the ideal obesity treatment should be fully covered by insurers. So if you're in Canada, by the provincial government, it should lead to sustained weight loss. And more than that, in addition to sustained weight loss, it should improve or even remit conditions associated with excess weight, such as type 2 diabetes, hypertension, high blood pressure, and sleep apnea. And further, it should be safe. As it turns out, there is a treatment that ticks all of these boxes. And it's widely available, but very underutilized. And that treatment is called bariatric surgery. Some people consider it a weight loss surgery. Others consider it metabolic surgery. So surgery to improve your metabolic health. So to improve conditions like type 2 diabetes. With this treatment, you can get sustained weight loss of 20 to 30%. And this is sufficient to sometimes cause remission of type 2 diabetes, obstructive sleep apnea, high blood pressure, and liver disease. Further, there's some evidence it can protect against heart disease, that it can protect against cancers, and that it can prolong life. Very effective treatment, but very underutilized. So we looked at our center, University Health Network. So we looked at all the people who were referred for surgery. So these people consented to being referred for bariatric surgery. They were eligible for bariatric surgery. 2/3 of them subsequently changed their minds. They did not have surgery. So, and what was the reason? The number one reason, they thought, I don't want to have an invasive procedure. Is it safe? So what we did was we looked at what happens to those people who underwent surgery compared to those who did not undergo surgery. And the answer was unequivocal. People who underwent surgery were less likely to die, less likely to have heart disease or kidney disease. So bariatric surgery is very useful. And one of the things I suspect that largely contributes to people not undergoing surgery is there's a little bit of stigma. It's almost thought of as a cosmetic procedure or as a failure of willpower. You couldn't do it on your own, and therefore you had to take the easy way out. I would say, however, that surgery is not the easy way out. You have to actually go through a 1-year preparation period before you undergo surgery. So you actually have to put the work in, but it's a highly effective treatment. Now, how does this affect South Asians? So if you look at the center where I work, I can actually count on my fingers the number of South Asian people that I have seen who have undergone this procedure. There are multiple reasons for this. One of them is that, as I alluded to earlier, the weight thresholds for which obesity treatments are approved in Canada and other places are based on Caucasian thresholds. That is undoubtedly one reason. But there is hope. Recently, in the States, they have lowered the weight thresholds at which they will approve surgery if you have type 2 diabetes. So this will be beneficial for people of South Asian descent. But I just wonder whether other factors, cultural factors, the stigma associated with obesity and weight loss surgery, whether those contribute as well. But I think that this is potentially a very beneficial treatment for obesity and type 2 diabetes and vastly underutilized. So my final take-home message is that bariatric surgery is the most effective treatment for obesity and type 2 diabetes. It's very safe, and it likely protects against heart disease, cancer, and death. And if you're in Canada, if you are eligible, it is covered by provincial insurance. There are some people who are not eligible, and we can discuss that later if time permits, but vastly underutilized and a very effective treatment. So thank you so much for your time, and hopefully we have enough time to answer any questions. There were 3 questions that were actually sent to me yesterday, and I think I've covered 2 of them in my talk. One of them that I didn't cover, and I'll just mention it here. What is a dangerous level of glucose if you're fasting or postprandial? I'm not entirely sure I understand the question, so this is my answer. If it's to diagnose diabetes, if you have a fasting blood sugar of 7 millimole or more, or random or 2-hour blood glucose after a glucose challenge of 75 grams of 11.1 millimole or more, then you have you're diagnosed with diabetes. Increasingly, we're using something called a hemoglobin A1C for diagnosing, which is a 3-month average of your blood sugar for diagnosing it. Now, in terms of if your blood sugars are high, long-term, your risk of getting conditions such as kidney disease, heart disease, loss of sensation in the feet is much higher. But in terms of immediate health concerns, hypoglycemia, so a blood sugar of under 4, is potentially dangerous, especially if you're on insulin or if you're taking a type of medication called sulfonylurea that can lower blood sugar. And if that's the case, you should take appropriate correction action. So take some dextrose or some juice and repeat again in 15 minutes and keep doing that until your blood sugar is more than 4. And once it's stabilized, you should definitely have something, long-acting carbohydrates, so crackers or a sandwich, something like that. And if you're driving, you should absolutely make sure your blood sugar is above 5. Now, the other concern with having high blood sugars is, long-term, it will cause all these complications. But in the short term, once your blood sugars start to go above 14, you start to pee a lot and you start to get thirsty. And once it's above 20, it can get really bad. So if the levels are like this, despite your treatment, you should contact your doctor. And if you're feeling tired, lethargic, have a temperature, or feeling unwell in any other way, you should probably go to the emerge. This is just general advice. Obviously, there may be other things to do in specific sort of circumstances. So I hope that answers this particular question, and I'd be very happy to take any other questions that may arise. Thank you once again.
Thank you so very much, Dr. Dash. I think it was very informative. I think one thing which probably, we understood today, because many times in our community, particularly, people kind of think that, diabetes is hereditary and they eventually are going to get it. So they don't act. It's very good and heartening to hear from you that, it can not just be prevented, but it can be reversed as well. And, I would like to hear actually Dr. Verma's view, who is doing a lot of work on preventive side, and he has worked a lot with community on these issues. And, it'll be very interesting to hear what he has to say on this. Dr. Verma?
Thank you, Riteshji, and thank you, Dr. Satyadesh. It was a very informative and highly educating information. Sir, I want to draw your attention toward one research article which is based on Ayurveda. Just go through this. Association of constitutional type of Ayurveda with cardiovascular risk factors, inflammatory markers, and insulin resistance. This article is available on the net. The proper research has been done, and it is written clearly in our text, which are around 5,000 years old. Ayurveda is the oldest medical system in the world. So 5,000 years old, our acharyas, our teachers, they wrote this, that particular type of person who are labeled as Vata and Kapha type, they are prone to catch diabetes, which was termed as Parmeh Rog in that time in Sanskrit language. This is the same thing. So 5,000 years ago, it was documented that the particular type of people are prone to catch diabetes. So this is very important, and this information is available in our text. And you mentioned and you laid a lot of emphasis in your lecture that genetic component is very important in diabetes. So we do agree, the Ayurvedic practitioners do agree, and it is written in Ayurveda. And the only thing is we need to do research. The advantage of genetic composition is, let me give you some introduction about body mind type. We divide the people into three categories. Vata type person. Vata type people are usually thin, having dry skin, these type of things. And it can be easily diagnosed by just questioning the person or by seeing the person. Similarly, Pitta type person, we can easily diagnose, and Kapha type person, this is the Kapha type body. So you can easily diagnose that what kind of complications or what kind of diseases they are prone to. It is very much mentioned in our Ayurveda text, and nowadays many softwares are available through which we can easily diagnose that this person is of having this type and they are prone to catch these diseases. And there are a lot of research has been done in this direction. There is another article. I just want to bring another article in your notice. Just give me 1 second. So many. So this is another article. Prakriti and its association with metabolism, chronic diseases and genotypes. The possibilities of newborn screening and lifetime of personalized prevention. So this concept of Prakriti or the genotype or the body-mind type is highly beneficial from prevention point of view, because in our text, in Ayurveda text, it is clearly written that if the person is having Kapha constitution, they should avoid these kind of diets. And if the person is having Vata constitution, they should avoid these kind of diets and these kind of lifestyles. So it is clearly written. And we are practicing this for the past 5,000 years. And these are all truthful informations. So kindly have a look on these articles, and I appeal to all the members of UHN, if they can look into the Ayurvedic concept of prevention of diabetes mellitus in relation to Prakriti and the constitution, that will be very, very beneficial from research point of view. Thank you, sir. Thank you, Riteshji.
Thank you, Dr. Verma. Yeah, Dr. Dash, would you want to add something to what Dr. Verma just said?
No, that's very interesting. I must confess, I'm not. This is not an area that I'm very aware of. So I look forward to reading these articles.
Perfect. We'll share this article. Okay, let's take some questions because we have some more time left. There's a question from participant Basu Gantoti. She wants to know, is exercising before meals better than or after meals, like exercise or walking?
So it depends. So if it's for blood sugar control, either immediately before or after is fine. I don't think it will make that much difference. Now, if you're doing, this is simple things like walking. Now, if you're doing higher intensity exercise, doing it after a meal might be challenging. So in that case, if you do it just before your meal, you will get beneficial effects on your blood sugars.
Okay. Another question from I think Mr. Girish Kekre. Dr. Dash, thanks for the information. I'm a patient of type 2 diabetes, currently prescribed 2 metformins twice a day. About a year back, I was prescribed Jardim. It helped me to reduce weight and control sugar. Can I reduce metformin?
Again, I don't know your specific details. So, just some general comments. So Jardiance or empagliflozin, it's a very good medication for preventing heart disease and kidney disease. And so you should definitely stay on that. Whether you can come off metformin or not would depend on your blood sugar levels and other health conditions. So that's probably best done in consultation with whichever doctor you see for your diabetes.
Okay. Sapna Sagar wants to know, like, what you were talking and recommending quite a bit about bariatric surgery. She says, what are the current guidelines to qualify for bariatric surgery?
Okay, so the current guidelines are in Canada. So you have to have a BMI of more than 40,
yeah,
or a BMI of more than 35 with an obesity-related condition. So that could include type 2 diabetes, it could be hypertension, high blood pressure, it could be heart disease or sleep apnea. So you have to have some condition with a BMI above 35. But in the States, and I know for a fact that there are some consultations ongoing in Ontario, they're trying to lower the BMI threshold so that if your BMI is between 30 and 35, and you have type 2 diabetes, you will qualify. Now, there is some data. So there is some data from small studies from India where they've actually operated on people with BMIs of less than 30 with type 2 diabetes with very good results. Now, an extreme form of, I told you that if you're unable to store fat on your thighs and buttocks, it's bad. A very extreme form of that is a very rare genetic condition called lipodystrophy. With these conditions, people can't make fat cells, so they have nowhere to store calories. So there, with body mass indexes of 18, 19, they get all the conditions you get with obesity, including type 2 diabetes. And even in those sort of cases, in some cases, it's so difficult to control that people have done bariatric surgery. And it's been very effective. So I think this is an active area of research, whether lowering the body mass index thresholds further for higher risk groups such as South Asians, whether that will have beneficial effects. I suspect it might.
Okay. Another question we have from Ajay Pratap is, how much will eating millets help if we avoid rice and wheat as the main cereal consumed? Because, you know, a lot of people in our community, they are very big on eating wheat and rice. So, like, do you have any thoughts on these?
So it will vary from person to person, depends how active they are, what their weight is, etc. But in general, I think green vegetables and the lean proteins are any kind of green vegetable, any kind of lean protein, the more of those you have, and the less of the carbohydrates you have, the better. Now, if you are going to have carbohydrates, the ones which have lower glycemic index, i.e. the ones that are less likely to put your blood sugar up, would be beneficial. So, for example, brown rice would be better than white rice. Whole wheat bread, brown bread would be better than white bread or bagels. So that would be sort of general advice. Okay. And things like chickpeas and lentils, etc., they do have some carbohydrates in them, but again, they're not going to put your blood sugar up that much.
We've got a lot of questions related to fruits, actually. How does natural sugar in fruits contribute to diabetes for a healthy person without any condition? How much fruits one should take? What all fruits they should take? Is there any limiting factor, particularly, you know, once you cross 50? Your thoughts on that?
Yeah, so there's a big difference. So fundamentally, what's the difference between, say, drinking juice and say, having orange juice and having an orange? If you drink orange juice, it's concentrated. It's liquid. It goes through your system very well, and almost all of it will get absorbed. So you'll get a big spike in your blood sugar, and then it will come down and you'll get hungry. Contrast that with a piece of fruit, say orange. You have the juice, which is in a smaller amount. You also have the fiber. So fruits are actually beneficial for health. I mean, obviously, if you were to have a large amount in one go, it can affect your blood sugar. But most people, if you're having sort of 2 to 3 servings a day, it's not going to do very much in terms of deleterious effects for health, and it can have health benefits. So that's the difference between having whole fruit versus juice.
Okay. So like, traditionally we've been hearing even from our parents and all that, okay, if you eat vegetables like Karela and all that really helps with sugar levels. Any thoughts on like what are good vegetables to eat if you want to avoid or prevent type 2 diabetes, or if you have just borderline diabetes, like the vegetables which are really good for you?
Yeah, so I don't think there's any sort of firm evidence to say that one type of green vegetable is better than the other. So in general, whichever green vegetables you like, because you have to make a change that is sustainable. So whatever green vegetables you like, have more of those. Now, there has been a lot of research interest in Karela, so bitter melon. And, the results have been sort of variable as to whether it improves or doesn't improve blood sugars. But it certainly, in moderate amounts, it doesn't cause any harm. So that's all I have to say about that.
Okay. I think we've covered most of the questions. If anyone has any more questions, we have 2-3 minutes more. You can actually post them. There's another question. Ozempic has become a desired drug for weight reduction, and as a result, diabetes phase 2, starting off with a dosage of 0.1 mg, most move on to 1 mg. 2 questions for you, sir. Are there any side effects of this drug? Second, does weight loss stop after some time of consistent use? This is from Kuldeep Sharma.
Okay. Yeah, so with Ozempic, the main side effect with this medication is that it can cause nausea and vomiting, sometimes constipation and diarrhea. So gastrointestinal side effects are the most common side effects. And so what we do to mitigate that is we start with a very low dose and we gradually increase the dose. And you can tailor the speed with which you increase the dose to the patient. And you can then go on to whatever dose, the highest dose that they can tolerate. So some people don't get up to 1 milligram. Some people may be able to only tolerate 0.25 or 0.5. So that's the main thing. In terms of beneficial effects, it lowers blood sugar, but it protects against heart disease. Some have evidence that it protects against kidney disease as well. And ongoing studies to see whether it protects against liver disease. Potentially they're looking at it in terms of Alzheimer's, Parkinson's, etc. So that's the first thing. Now, with any weight loss treatment, it could be lifestyle, medications, or surgery, eventually the weight loss will plateau. Now, the amount of weight that you will lose with Ozempic or higher doses will vary from person to person, but eventually it will plateau. Okay. And we don't have the data going beyond 2 years now, but the data suggests that it's maintained for 2 years at least. Okay.
Also, doctor, like a couple of people have been asking if they want to consult with you or anyone related to preventive, or if they think like you outlined a couple of things, that if your waistline is more than this, if you are above 40, certain, criteria you outline, you should go consult your doctor. If somebody wants to consult with you, how they should contact you? I think a lot of viewers have been asking that.
Well, the family doctor would have to make a referral to me, and I'd be happy to see them.
Okay, fantastic.
And another question that was asked. Sorry, I just quickly saw another question.
Sure.
So which types of fruits should you have? If you're eating small amounts of fruit, I don't think it matters too much. But if you have type 2 diabetes, certain fruits likely have higher glycemic index. So someone was asking about sort of pineapples, and someone else was asking about watermelon. Those probably do have higher glycemic index. So the best thing to do would be, in this situation, would be to perhaps speak with a dietitian or someone who can go through your dietary history in detail, find out what foods you like and don't like, and which ones would be sustainable, which changes would be sustainable for you.
Okay. So I think last question I would want to ask you is like, how much role hereditary plays in actually making you a type 2 or type 1 diabetic or other issues? can it be 100% prevented by, being cautious, exercising regularly, avoiding the foods, and doing everything possible to prevent that? Or, eventually it's going to catch you up no matter what?
That's a very good question, and it's complicated. So the way I'd look at it is this. So for most people, several hundred genes and changes in several hundred genes are responsible for your risk for getting type 2 diabetes or your risk for getting obesity. However, there are some people who have a fault in a single gene, and that is sufficient to then cause type 2 diabetes. So for example, I was talking earlier about a very rare condition called lipodystrophy. So these people, they have a faulty gene, one faulty copy, and that is sufficient to have problems with how much fat they can make, and that is sufficient to cause type 2 diabetes.
Mm-hmm.
Now, but then for most of us though, however, it's a combination of many hundred sort of genes, and how you respond to a certain intervention, lots of factors come into it. So the sort of interventions that I identified, most people will respond, but there will always be some people who will not respond. And it's hard to predict who will and who won't. But irrespective, even if you don't fully respond, you will still get health benefits. And that's the key point to emphasize. The other key point to emphasize is age. Your risk of everything goes up with age. So let's say you achieve type 2 diabetes remission. As you get older, all your organs get older as well.
Right.
So what will happen long term, your blood sugars may end up going back up again long term as well.
Okay. All right. Thank you so very much, Dr. Dash. I think it was really informative, and if it can help, people who attended today and a couple of other people who will eventually watch it on YouTube or other platforms where your talk would be available, I think we've achieved what we wanted to achieve. And I would like to thank everyone who actually came out today to listen to Dr. Dash. I would like to thank our media partners, Y Media, who actually showed this live on their TV. And this brings us into this great session today. And on behalf of Canada India Foundation, our chair, Satish Thakkar, Dr. Dash, I would like to thank you and each one of you for participating on this Saturday morning. Thank you so very much.
Dhanyavad.